Climate change is reshaping global health, introducing new medical conditions. Learn about emerging health risks and actionable steps to protect yourself and your loved ones from climate-related health impacts. Climate change. It's a phrase we hear often, conjuring images of melting glaciers and rising sea levels. But its impact extends far beyond the environment, reaching into the very fabric of our health and well-being. As our planet warms, we're witnessing a surge in extreme weather events, shifting ecosystems and rising pollution levels, all of which pose significant threats to human health. This isn't a distant threat, it's a present reality, and understanding its implications is crucial for safeguarding our well-being and that of generations to come. But what exactly does this mean for our health? Let's dive in. Our atmosphere, a delicate shroud that sustains life, is facing an invisible threat. Rising global temperatures exacerbate air pollution, creating a toxic cocktail that's particularly harmful to our respiratory system. As temperatures climb, they accelerate the formation of ground-level ozone, a key component of smog. This invisible menace irritates our airways, triggering a cascade of respiratory problems, from asthma attacks to chronic obstructive pulmonary disease. Wildfires, fueled by hotter, drier conditions, release massive plumes of smoke and particulate matter into the atmosphere. These microscopic particles can penetrate deep into our lungs, exacerbating respiratory illnesses and increasing the risk of cardiovascular disease. The very air we breathe, once a source of life, is becoming increasingly hazardous, demanding our attention and action to mitigate this growing threat. As our planet heats up, extreme heat events are becoming more frequent and intense, posing a direct threat to human health. Heat waves, once a seasonal anomaly, are now a recurring danger, pushing our bodies to their limits. The human body is remarkably resilient, able to regulate its temperature within a narrow range. But when exposed to prolonged extreme heat, this delicate balance is disrupted, leading to a cascade of health problems. Heat exhaustion, characterized by dizziness, fatigue, and nausea, is often the first sign of our body struggling to cope. If left unaddressed, it can escalate to the life-threatening condition of heat stroke. The elderly, young children, and those with underlying health conditions are particularly vulnerable to heat-related illnesses. As temperatures continue to rise, understanding the risks of extreme heat and taking proactive measures to stay safe will be crucial for protecting ourselves and our communities. In the interconnected web of life, even subtle shifts in climate can have far-reaching consequences. As global temperatures rise, we're witnessing an alarming trend: the expansion of vector-borne diseases. These diseases, spread through the bites of infected insects like mosquitoes and ticks, are on the rise, posing a growing threat to human health. Mosquitoes thrive in warmer temperatures and increased rainfall, breeding in new areas and for longer periods, increasing the transmission of diseases like malaria, dengue fever, and Zika virus. Ticks, too, are benefiting from warmer temperatures, expanding their range and bringing with them the threat of Lyme disease, a debilitating illness that can cause long-term neurological problems. Protecting ourselves requires understanding their life cycle, recognizing the symptoms of vector-borne diseases, and taking preventive measures to minimize our risk. Our planet's intricate ecosystems provide the sustenance that sustains us, but climate change is disrupting these delicate balances, jeopardizing food security and putting millions at risk of malnutrition. Agriculture, the foundation of our food supply, is highly susceptible to the impacts of climate change. Rising temperatures, extreme weather events, and shifting precipitation patterns threaten crop yields and livestock production. As food production becomes less reliable, food prices soar, disproportionately impacting the most vulnerable populations. Malnutrition, in its various forms, can stunt growth, weaken immune systems, and increase susceptibility to diseases, perpetuating a vicious cycle of poverty and ill health. Securing a sustainable and resilient food system in the face of climate change is paramount for ensuring the health and well-being of current and future generations. The fury of a hurricane, the relentless deluge of a flood, the destructive power of a wildfire. Extreme weather events fueled by climate change leave a trail of devastation in their wake, not just physically but emotionally and mentally as well. The immediate trauma of experiencing such events can be deeply unsettling, triggering anxiety, fear, and grief. The loss of loved ones, homes, and livelihoods can be overwhelming, leading to long-term mental health consequences. Post-traumatic stress disorder, depression, and anxiety are just a few of the challenges faced by those who have lived through these harrowing experiences. Addressing the mental health impacts of climate change requires a multifaceted approach that provides both immediate support to those affected by disasters and long-term strategies for building resilience and fostering mental well-being in the face of a changing climate. Los Angeles, a sprawling metropolis bathed in sunshine, often evokes images of Hollywood glamour and endless summers. But beneath its vibrant facade, a silent health crisis is unfolding, fueled by the invisible hand of climate change. The city's iconic skyline is often obscured by a thick blanket of smog, a stark reminder of its struggle with air pollution. Rising temperatures exacerbate the formation of ground-level ozone, a key component of smog, irritating airways and triggering respiratory distress. Los Angeles' unique geography, nestled between mountains and the Pacific Ocean, traps pollutants, creating a toxic cauldron that particularly impacts vulnerable populations, children, the elderly, and those with pre-existing respiratory conditions. Warmer temperatures extend pollen seasons, subjecting allergy sufferers to prolonged misery. The case of Los Angeles serves as a stark warning of the interconnectedness of climate change and respiratory health, demanding urgent action to clear the air and protect its citizens. The Pacific Northwest, a region known for its temperate climate and lush greenery, experienced a shocking wake-up call in the summer of 2021. An unprecedented heat wave, fueled by a phenomenon known as a heat dome, shattered temperature records, pushing the region to its limits and exposing the deadly consequences of extreme heat. For a region unaccustomed to such extreme temperatures, the heat wave was particularly dangerous. Many homes lacked air conditioning, offering little respite from the relentless heat. As temperatures soared, hospitals were inundated with patients suffering from heat exhaustion and heat stroke. The 2021 Pacific Northwest heatwave serves as a stark reminder that climate change is increasing the frequency and intensity of extreme heat events, even in regions typically known for their mild climates. In the shadowy undergrowth of forests and meadows, a tiny creature lurks, its bite carrying the potential for debilitating illness. The black-legged tick, a carrier of Lyme disease, is expanding its range, a silent beneficiary of our warming world. Lyme disease, once confined to a few regions, is now emerging in new areas, posing a growing threat to human health. As temperatures rise, ticks are able to survive in higher altitudes and latitudes, expanding their territory and bringing with them the risk of Lyme disease. The disease, caused by a bacterium transmitted through tick bites, can cause a range of symptoms, from fever and fatigue to debilitating joint pain and neurological problems. The silent spread of Lyme disease serves as a reminder that climate change is altering the landscape of infectious diseases, demanding our attention and proactive measures to safeguard our health. The year 2005 etched itself into the annals of history with the fury of Hurricane Katrina. The storm, one of the deadliest and costliest in U.S. history, ravaged the Gulf Coast, leaving a trail of devastation in its wake. But beyond the physical destruction, Katrina's legacy is one of profound and enduring mental health consequences. The storm's images remain seared into our collective memory: flooded streets, shattered homes, and desperate pleas for help. For those who lived through the storm, the trauma is deeply personal, a constant companion. Post-traumatic stress disorder, anxiety, depression, and substance abuse became tragically common in Katrina's aftermath. Hurricane Katrina stands as a stark reminder that the mental health impacts of climate disasters can far outlast the physical damage, demanding ongoing support, resources, and compassion for those who have endured such profound loss. Water, the elixir of life, is becoming increasingly scarce and perilous in a changing climate. As temperatures rise and rainfall patterns become more erratic, droughts plague once fertile lands, while floods contaminate water sources, setting the stage for a surge in foodborne illnesses. Access to clean, safe drinking water is fundamental to human health, but climate change is jeopardizing this precious resource. Droughts, exacerbated by rising temperatures, deplete water sources, forcing communities to rely on potentially contaminated water for drinking, cooking, and sanitation. Floods, too, pose significant risks, overwhelming sewage systems and contaminating water supplies with harmful bacteria and viruses. These contaminated waters can lead to outbreaks of cholera, typhoid fever, and other waterborne diseases, particularly in regions with limited access to sanitation and healthcare. Extreme weather events can disrupt food production and distribution, increasing the risk of food spoilage and contamination. Ensuring access to safe water and food in a changing climate requires a multifaceted approach that addresses both the root causes of climate change and strengthens our resilience to its impacts. Our journey through the interconnectedness of climate change and health has revealed a sobering reality. Climate change is no longer a distant threat. It's a present danger to human health, impacting everything from the air we breathe to the water we drink. But amidst these challenges lies a glimmer of hope. We have the power to act, to mitigate the health risks of climate change and create a healthier, more sustainable future. Knowledge is our first line of defense. By staying informed about air quality, weather patterns, and local health advisories, we can make informed decisions to protect ourselves and our families. Adopting preventative health measures, from staying hydrated during heat waves to using insect repellent to prevent vector-borne diseases, can significantly reduce our risk. But our actions must extend beyond individual responsibility. We must advocate for climate-friendly policies, support sustainable practices, and hold our leaders accountable for creating a healthier planet for all. The challenges are significant, but the stakes are too high to ignore. Climate change is not a distant problem, it's happening now. Stay informed, take action, and be part of the solution. For more information on climate change and health, visit allaboutmyhealth.com. Don't forget to like, share, and subscribe for more health insights.